Mentioned, I'm the clinical director on the course, and I'm going to be talking to you today about our clinical placements. So in the other side of my work in the NHS, I've had experience of supervising trainees myself on placement in a number of service settings, so I know what a rewarding and valuable experience it can be, not only for the trainee, but also for the supervisor and for the wider services. And hopefully today's presentation will give you some idea of what to expect in terms of placements at Queen's. So where they are, what they involve, and the support available from the course. Okay. So firstly, just to introduce you to our clinical tutor team. So each trainee is allocated a clinical tutor at the start of training. So there's myself, there's also Jenny Cross, Kelly Martinez, Annie Malone-McAteer, Sharon Fraser, and David McCormack. So the idea is that your clinical tutor can be a consistent presence and source of support throughout your training. And we are, of course, supported in that by other course staff, not least of which the excellent admin support that we have for our placement. But these are the staff that, if you're on the training course, you're most likely to be seeing in terms of regular contact about your placements and how they're going. So between us on the clinical tutor team, so I'm also a clinical tutor for some of our trainees, we have a really wide range of clinical experience, which is lovely. So in terms of our backgrounds, there's child and adolescent, clinical health psychology, older adults, intellectual disability, adult mental health. So we've got quite a lot of coverage between us. So the clinical tutor can hopefully provide a sense of continuity as trainees transition between their placements over the course of training. And we do provide opportunities for trainees to meet with their clinical tutors on a one-to-one basis at the start of training before people are going out on their first placement, so that you know who you can contact in case of any issues, and so that there's a familiar face at your placement meetings as well. Our clinical placements are really a core part of clinical training, a really substantial component of it. In fact, about 50% of your time on training would be spent out on clinical placements. And the emphasis is really on promoting development of skills in effective clinical practice and working towards competency-based learning outcomes, really making sure that we're meeting the standards and requirements of the BPS and the Health and Care Professions Council. And our placements are provided in partnership with our local HSE trusts. They should be engaging, challenging, of course, because you're learning new skills, but also a rewarding and positive learning experience. And providing an opportunity to put into practice HSE values such as compassion, excellence, and working together. And also trainees are very much able to contribute to service provision and client well-being from the outset of training. So where are our clinical placements? Well, the Queen's course is a regional training course, so there should be an expectation that placements can be in different trusts across Northern Ireland. When allocating the placements, we do need to take into account both learning needs and, where applicable, any specific individual circumstances for all the trainees across the course. So it is important to be aware that when we're weighing up all of those different factors, there is likely to be some travelling involved to placements throughout the course of training. In terms of clinical areas, then, trainees have the opportunity to work with a variety of clinical populations, such as adult mental health. So that might include presentations such as anxiety, depression, post-traumatic stress disorder, obsessive compulsive disorder, psychosis, for example. Also child and adolescent services, such as child and adolescent mental health services, intellectual disability, neuropsychology, older adult, clinical health psychology, and a range of more specialist services. And trainees also have the opportunity to work within a range of service types, maybe outpatient and inpatient working, and working with different multidisciplinary teams. And varied approaches for intervention as well. So direct clinical work, of course, but also working indirectly, perhaps through liaison with carers or with other healthcare professionals, delivery of individual and group interventions, and experience with a range of therapeutic modalities, for example, cognitive behaviour therapy or systemic. There is an opportunity for trainees to gradually sort of develop their own areas of interest and styles of working over the course of training. But often people find that they learn a lot, even from clinical areas that might not initially have been their main area of interest. So it's good to keep an open mind when approaching working with different client populations on placement. So this is a busy time of year for us at Queen's. We've got our first years have just been allocated their first placements, and they'll be going out to meet their new supervisors and teams in just a couple of weeks' time. And I know from liaison with our supervisors just how welcomed the trainees are onto placement and how valued they are in terms of the clinical work that they provide on placement as well. One of the benefits, I suppose, of Queen's being having that intake of about 21 trainees per year at present, rather than, some of the courses that are substantially larger than that, is that the supervisors tend to be well known to the course team, and those existing positive working relationships can help the placements to run really smoothly. So in terms of what clinical placements involve, they would involve working under close supervision from a qualified clinical psychologist. And in some settings, supervision might be provided by another practitioner psychologist or psychological therapist. Gaining skills in working clinically with clients across the lifespan, aiming to reduce distress and improve quality of life, and gaining skills in assessment, formulation and intervention, as well as broader skill sets and learning about professional issues, such as understanding the professional role, organisational influence, leadership, equality, diversity and inclusion, and patient and public involvement. And there's an emphasis throughout on linking theory and practice, so really applying the teaching from Queen's within clinical work on placement, and clinical practice being very much informed by relevant theory and research findings, really putting that clinical science into practice and providing empirically supported psychological interventions, as well as evaluating the outcome of those interventions. And trainees are then able to bring their clinical experience and observations back into the classroom, and that can really complement teaching and enhance their learning. And as already mentioned, we're really working towards trainees taking on that reflective scientist practitioner role. So across the 3 years of training, we have 5 placements. In the first year, there's a longer clinical placement that runs from November to the September of the following year to really let people settle into that first clinical setting. And then in years 2 and 3, there are 4 further placements that are each about 6 months in duration. So usually people are on placement for 3 days a week during term time, and that would increase to 4 days a week during the summer. So years 1 and 2 are really focusing on those core placements for development of key competencies. And in year 3, there's a bit more scope for tailoring to individual needs and opportunities for trainees to explore specialist areas of interest, really consolidating learning and preparing for the transition to working as a qualified psychologist. So the year 1 placement should provide experience in the assessment and treatment of common presentations of adulthood. So maybe anxiety, adjustment difficulties, depression, obsessive compulsive disorder, could be persistent physical symptoms such as pain, post-traumatic difficulties, etc. And trainees on this placement will have the opportunity to work with clients using a cognitive behavioural approach. The 2 placements in second year then, trainees gain experience within child and family services, so for example, child and adolescent mental health services or paediatric psychology, and also intellectual disability or neuropsychology. And here there should be opportunities for trainees to work with clients using a systemic approach, as well as other evidence-based approaches. And then in third year, we have a really wide range of specialist and elective placements. So for example, neuropsychology, forensic settings, neonatal services, specialist CAM services, specialist paediatric psychology, older adults addictions, psychosis, eating disorders, perinatal, specialist intellectual disability services such as forensic, and looked after children. And when allocating placements, it always strikes me how lucky we are as a programme team to be able to draw upon such a depth of expertise and knowledge and enthusiasm in the area from our supervisors. Thinking then about what our trainees tell us they value about their placement experiences, we're very keen to get trainee feedback, and we conduct regular placement audits that give us some information on this. So recent qualitative feedback highlights some positive placement experiences, such as trainees feeling valued on placement, developing their confidence, gaining a deeper understanding of the clinical area, receiving constructive feedback, experiencing their supervisors as attuned to their needs, feeling inspired, feeling that there's a rigorous approach to learning on placement, and describing their placements and supervisors as brilliant or exceptional. So lovely to hear that feedback. And where we have permission, we do pass that on to supervisors as well. Some of the additional comments highlighted that trainees really value developing a sense of competence and capability on placement, trying out new skills, a safe space and supervision for reflection, a supportive and encouraging working environment, and their supervisors being approachable and accessible. The placement planning process between the trainee and supervisor makes sure that there's a really good, robust plan in place for the placement, and that covers things like the clinical population, modes of working, psychometric assessment, the primary and secondary therapeutic models for the placement, any considerations around equality, diversity and inclusion, and engagement with service users, as well as the plan for supervision and for mutual observation. Importantly, any trainee goals, requirements and needs to be met on the placement, as well as an overview of relevant reading. And then placement monitoring involves mid and end of placement meetings with the trainee, supervisor and clinical tutor, and there are ratings of competencies at that point. Clinical logbook is completed to ensure that trainees are accruing the required range of clinical experience required to meet BPS accreditation criteria. And it should be a supportive process with a focus on progress, strengths and areas for further development, as well as an opportunity for trainees to give their feedback and experiences of placement. And all the way through, we're really keen to emphasise trainee support around placement. Really want to provide people with a safe and supportive learning environment. The placement supervisor is a good first port of call for any issues to be discussed around placement, but the clinical tutor is also a consistent point of contact and support, not only at the placement meetings, but in terms of informal contact when needed, and really emphasising getting to know trainees on an individual basis. As clinical director, I'm also very happy for people to get in touch with me with any queries. And on our placement panel meetings, which happen twice a year, we have a trainee representative from every year group. So the cohort gets to feedback and raise any questions with the programme team as well. So overall throughout, there's a really strong emphasis, not only on the clinical skills development, but on trainee experience, feedback and well-being. Thank you. I'll stop sharing my screen.